Ejiofor Innocent Mary from Nigeria. The title of our research that I'm presenting is the Synergistic Antidiabetic Evaluation of two plants, which are Andrographis Paniculata and Vernonia Amygdalina. This our outlines. Then, as we all know, diabetes is a metabolic disorder characterized by a high blood glucose level, and is currently one of the most chronic, non-communicable diseases in contemporary society. Even though there are drugs currently used in managing diabetes, there is need for more better option. And plant sources are one of the areas being researched these days for better options for management or treating diabetes. So in this our research, our aim is to determine the synergistic anti-diabetic property or antihyperglycemic effect of two plants, Andrographis Paniculata and Vernonia Amygdalina, using rat model, alloxan-induced diabetic rat model. This is our objective: carry out extraction, do phytochemical test, do the antidiabetic study, and then look at the histology of the pancreas. We got animal ethic approval before carrying out the studies. This is our method. We collected the sample and prepared them, and they did the extraction both with cold extraction and hot extraction using succulent. Then we carried out acute toxicity studies, phytochemical test, and then went on to carry on the diabetic studies, the antidiabetic studies. This is our experimental design. For each group, we used 5 animals. Then our standard drug, we used metformin. Then for each of the extracts, remember we have a cold and hot extract. For each of the extract, for the extract, we mixed both of them, and then for the cold one, we used the concentration of 250 milligram per kg body weight and the 500 milligram per kg body weight. And also for the cold mixture, we also did the same, 250 per kg body weight and the 500 milligram per kg body weight. This is the result of the individual phytochemical tests. The individual phytochemicals present in the extracts and also the ones absent. So the plus sign indicates the present one, the minus sign or the negative sign present the ones absent. So this is the result of our antidiabetic study. This is the tabulated result. This is the graph. As you can see, there is decrease in blood glucose level as we went on with the treatment, except for diabetic control that kept increasing. And then we calculated the percentage decrease, and you can see also that the percentage decrease kept increasing until the 14th day. And then the weight also, after induction, the weight of the animals dropped, but as we went on with treatment, their weight increased, started increasing to normalcy. And this is the histopathological evaluation. We found out from the histopathology that some of the animals, their pancreas were not affected. The histo architecture were not affected, while some the histo architecture was moderately affected. Then we found out that from our studies that there are some previous studies that had been carried out individually on these plants. So we found out that our combination gave a better anti-diabetic result than the individual studies. So we are doing further studies to see what actually happened in these animals that resulted to this that gave rise to the result we obtained. We're also looking at the pancreas. We're also suspecting the possibility of beta cell regeneration, which is the study we are doing now, to see whether there was a beta cell regeneration at all. We're also looking at insulin level, apart from just taking the glucose level. These are our references. Thank you.